Welcome back for the second portion of Joy in Our Town. Thank you for joining us once again. I'm your host, A.C. Dunlap, and our guest for this segment is Marian K. Schuda M.D., Board Certified Geriatrician for the OhioHealth Gerlach Center for Senior Health. She joins us today to discuss senior health and wellness, along with the importance of physical and social activity for older adults. Welcome.
It's a pleasure to be here, AC.
Thank you for joining us. Can you tell us a little bit about your history with the organization?
Oh, I've been at OhioHealth for over 35 years. It's a wonderful place to work. The Gerlach Center for Senior Health has been open at its current site for about 22 years. And it's just a privilege to work there. It's a wonderful place.
So now what exactly are your responsibilities within the program?
Well, I'm a medical director there, but I also see patients in what we call geriatric assessments, which is a comprehensive look at an older adult. It's multidisciplinary. So we include social workers, nurses, pharmacists, and so forth.
So can you talk to us a little bit about the importance of physical activity for seniors?
Oh, yes. Almost every time it's been studied, physical activity has been shown to be a benefit, and it can be very modest by today's standards. So as we watch the Olympics, we see all these well-conditioned athletes doing amazing things, but even very modest activity like walking every day, even splitting it into 10-minute walks has been shown to be helpful for people.
Can you tell us a little bit about why it is important for seniors to be active?
Yeah, that's a great question. When we measure effects that are good for people, such as high blood pressure, lowering high blood pressure, improving blood sugar control and diabetes, improving hours of sleep, very modest exercise has been shown to improve all of those things. And who doesn't want to have a good blood pressure and restful sleep? It's very, very helpful for us. So, and it's hard to exercise for some people. Certainly, people even who can sit in a chair can do some movement-based exercises that have been shown to be helpful. So I encourage everyone to do what they can do a little bit every day. It's been very helpful for people. In fact, I often give people just a poster that shows them walking the dog or walking around in their house, just to get people moving a bit. If they can't walk, a stationary bike is a great way to get some movement.
What do you think are the barriers maybe for older adults when it comes to exercising?
Well, I tell people if they haven't been doing it for a long time, and oh my goodness, about 80% of adults really don't exercise as much as they ought to. It's hard to get moving, and it can be daunting. So I tell them it's just like the Marines at boot camp. They can't climb the wall the first day of boot camp. You got to work up to it. So I ask them to start with something very modest, like walking 5 minutes by a timer every day, and then adding 5 minutes a day until they get up to 30 minutes most days.
Do you find that seniors are more motivated maybe in groups when it comes to physical activity?
Oh, I agree with that. I think most of us are more motivated in groups. And the thing I tell them to do is to, I hopefully empower them to feel if they join a group at a senior center and they're just starting, feel comfortable leaving before the exercise is over, because again, they need to build up to a full course of exercise. Some people are too embarrassed to do that at first.
So those who have barriers, what suggestions would you give them?
Yeah, that's a good question too, because a lot of people as they get older have aches and pains that limit them from doing much. So there are a fair number of people who really can't walk because their knees hurt or their feet are hurting. I recommend that they use a stationary bike or pedalers, which are available. For people who like pools, there are several very warm water pools around the city, and those are a great way to get an aching joint moving without having any pressure on it. And again, there's almost always a way to find something for somebody. We even have chair-based programs. Some of them do it on videos at home, but there are also some senior centers that have chair-based movement activities, and those have been shown to be helpful too.
Oh, wow. Now, does the Ohio Department of Health work with other organizations to kind of encourage physical activity for seniors?
Well, yes, and the Ohio Advisory Council on Aging has a number of initiatives to try to help keep Ohio seniors healthy, so yes.
Can you talk a little bit about healthy eating when it comes to seniors?
Yes, we do spend a lot of time talking about that too. I suppose the best thing to do is what I tell my patients to do, what Grandma always told you, and that's eat your vegetables and mix them up. So the best studies we have on diet say that, first of all, you cannot substitute for a bad diet with vitamin pills or supplements.
Okay.
It's really, really important to eat a wide variety of fruits and vegetables. What does that mean? Well, 5 to 7 servings a day. A serving is a half cup if it's a normal vegetable or fruit like a grape. If you dry it and make it a raisin, it's only a quarter cup.
Oh, wow, okay.
And nuts count, and whole grain breads count, and so forth. So 5 to 7 servings a day. And it's best to have a variety of colors. Some dark greens, some orange like carrots or, peaches, that sort of thing. And then at least 3 ounces of protein a day. It can be more than that, but some seniors eat alone, and it's hard for them to cook enough. So 3 ounces of protein would be a chicken breast, 3 eggs, 3 thick slices of cheese, something like that. Okay. So at least that amount of protein plus the fruits and vegetables.
Now, is it important to have a balance of physical activity and eating well to be healthy?
Yes, I'd say that's true. We have to eat, of course, to live. And physical activity is just very important. It's, again, been shown to improve hours of sleep, reduce blood pressure, improve blood sugar. In some studies, it's been shown to probably prevent progression of memory loss as long as you start it before there's significant memory loss. So it's very important.
Okay. Can you talk a little bit about maintaining a healthy weight?
That's a good question, too. There's some controversy about that if you read the literature now about what's an appropriate healthy weight. It is true that people who maintain what we would call an ideal body weight seem to be the healthiest as long as they're not too underweight. Okay. And people who are very overweight definitely have a higher risk of sugar diabetes or diabetes and high blood pressure. Okay. So a good body weight's very important. Staying active and eating a wide variety of good foods is also important too. And stay tuned on that for an ideal weight because there's much more being done about that in research.
Okay. Now I believe OhioHealth has a program, Advantage program.
Yes.
Can you talk a little bit about that?
Yes, that's a program for seniors that they join and get notifications about programs that are unique for seniors. I'd say one of the more popular programs in that, in the Advantage program is the Food for Thought, which is a monthly lecture over the lunchtime that covers a wide variety of topics that seniors like. For example, various health-related topics with physicians and others giving the topic. Things about doing paperwork for powers of attorney and so forth. Also certain estate planning things, senior trips, that sort of topic. That's one of the more popular programs.
Okay. So what is classified or who is classified as a senior? I know
Yes.
age has kind of differed over the years. So what would you classify as a senior?
Yeah, that's a great question. I get asked that a lot. Officially for us, it's anyone over 65.
Okay.
But I will tell you that in a country, most Western countries where we have adequate diet and immunizations and so forth, most people are really pretty healthy until they're about 75.
Wow.
And between 75 and 85, there's a lot of variability in how healthy people are. Part of that's related to health habits. Do they take care of themselves? Do they exercise? Do they watch their high blood pressure and so forth? Over 85, all of us are pretty frail, although we all know some very fit 90-year-olds. So there are certainly exceptions to that.
Do you see any differences from a cultural standpoint?
I'd say that for the bulk of us here, most of us are not physically active as we ought to be. But of course, there are some people for whom physical activity's just been a part of their life. Some people who have dogs like to walk them regularly, and that's good exercise. Some people play golf. I am not one of those people, but that's apparently can be a good walk.
Okay.
But for the most part, I really do have to tell people to just turn it up a little bit. Most of us are pretty inactive.
So what type of tips would you offer seniors who are looking for places and resources just to kind of be active?
Yeah, that's a good question too. We usually tell people to just start with something you like to do.
Okay.
Because if you choose something you hate and it's torture for you, you just won't do it. Some people like to do puzzles, some people like to take walks, some people like to swim. If you're afraid of water, swimming would be awful for you. So we try to work with people to figure out what they like to do and what's safe for them to do too. The senior centers around this metropolitan area have a wealth of activities and lots of people to help. So we'll often point them to the local senior center.
So how do you deal with the senior who has not really had a history of physical activity and doesn't really want to work out, but maybe has health issues?
Yes, I try my best to convince them that just to start a little bit, and really with 5 minutes of walking, if they can walk, or pedaling in front of their favorite show with the clock so they know they're really doing it, and that's a way to get started. And I can tell them that I can promise them they'll feel better because it's so consistently been shown to be the case.
Okay. Consistency, you use that word. Why or is that an important factor in staying healthy?
Yeah, that's a good question too. The best studies we have show that people who exercise 5 days out of 7 or eat their diet regularly, consistently, really are healthier. They live longer, they report feeling better, they report fewer illnesses and so forth. So it is a little game of inches, a little bit here and a little bit there.
Not immediate gratification, right?
No, it's not that. You're right.
What has been the impact of the programs that OhioHealth has that you have seen as far as in the community, the ones that you know that are out there that people have taken advantage of? Have you seen an impact as far as the community?
Well, I do hear back from people that they felt that our services were really, really helpful to them. We tend to see a lot of people who are struggling to stay in the community, and our social workers often connect them to a variety of services people just wouldn't even know about if they didn't come through the center. So various aging programs, friendly visitors, the senior centers, some of them don't have any idea what those kinds of programs are out there for them.
We thank you very much for your time and for allowing us to tap into this information at OhioHealth, and I'm sure it's going to be a major resource for some people. That's our program for today. Thank you so much for watching. You can also check us out on Facebook at WSFJ TV 51. Join us again next week at the same time for Joy in Our Town.
This program has been sponsored by the Trinity Broadcasting Network and is made possible by your telethon dollars. Your continual support can keep Joy in Our Town coming to your home every week. Write to Joy in Our Town, 7790 North Central Drive, Lewis Center, Ohio, 43035.